Most women over 50 have never been told this medical truth. According to the North American Menopause Society, over 52% avoid intimate touch due to dryness, pain, or body shame. Yet many men still crave that closeness, not out of lust, but biology. What if his desire to kiss you there was actually a neurochemical act of bonding proven by science, not seduction? I'm Dr. Eliza Hart, a board-certified obstetrician and gynecologist with over 15 years of experience in women's health and hormonal wellness. Through thousands of consultations, I've seen how menopause silently reshapes not only a woman's hormones, but also her confidence and connection. Many believe men's desire fades with age, yet science tells a different story. Modern neurobiology reveals that male intimacy often stems from oxytocin and dopamine, the same chemicals that create emotional bonding and long-term attachment. In today's video, we'll explore what truly drives this desire, the hormonal changes that affect both partners, and how understanding these mechanisms can restore not just pleasure, but trust and self-worth after 50. If this topic resonates with you, please subscribe and help me reach our first 10,000 subscribers so we can grow this channel together. Type 1 if this speaks to you, or 0 if you'd like me to cover a different aspect of women's health next time. 1. The neurochemical drive behind male intimacy. When we talk about intimacy after midlife, many people still assume desire is purely physical, something that happens below the skin rather than inside the brain. Yet modern medicine paints a far more complex picture. Every intimate gesture, including a man's wish to please his partner, begins with neurochemistry. Within the male brain, desire is less about dominance and more about a cascade of hormones, chiefly oxytocin and dopamine, that shape connection and bonding. Oxytocin, often called the bonding hormone, is released through affectionate touch, eye contact, and gentle physical closeness. It calms the nervous system, lowers cortisol, and sends messages of emotional safety throughout the body. Dopamine, meanwhile, is the neurotransmitter of reward and satisfaction. It fuels motivation, reinforces positive experiences, and keeps the brain engaged in acts that feel meaningful. When these two systems work together, they form a closed biological loop that drives emotional intimacy as strongly as physical pleasure. Research from the University of Chicago in 2019 demonstrated that even non-sexual contact, prolonged touch, or affectionate kissing activates the same neural regions associated with empathy and trust. For many men, this physiological pattern becomes their way of expressing love. It is not driven by performance, but by the instinct to connect and to be accepted. As men age, slight reductions in testosterone can actually make them more responsive to oxytocin, heightening their emotional awareness. What once looked like passion becomes a neurochemical signal of affection and reassurance, a way to sustain closeness when words often fail. From a psychological viewpoint, this reflects what behavioral science calls the reinforcement feedback loop. When a man perceives that his partner enjoys the moment, his brain releases more dopamine, confirming his role as a capable and valued partner. This creates an upward spiral of emotional validation, strengthening not only his attachment, but also her sense of being cherished. Over time, this process transforms intimacy from a youthful impulse into a mature form of communication, one built on safety, empathy, and mutual recognition. Understanding this mechanism can dissolve old misconceptions. It allows women to see their partner's desire not as lust, but as the brain's biological effort to maintain emotional connection. True intimacy, as neuroscience continues to show, is a full-body dialogue between chemistry, emotion, and trust. The science is remarkably clear. Long before intimacy reaches the body, it begins within the chemistry of the human mind. 2. Hormonal shifts in women after 50 and their impact on sensation. The changes women experience after 50 are not signs of decline. They are biochemical adaptations. While men's neurochemistry often drives them toward connection, a woman's body is undergoing a quieter but equally powerful transformation inside her hormonal system. The decline of estrogen, progesterone, and even trace amounts of testosterone reshapes how blood vessels, nerves, and tissues in the feminine area respond to touch. Understanding these changes is the first step toward restoring comfort and sensitivity rather than surrendering to loss. Estrogen is the primary architect of moisture elasticity and healthy blood flow in genital tissue. When its levels drop during menopause, the mucosal lining becomes thinner, nerve endings receive less oxygen, and circulation slows. The result is dryness, tightness, and sometimes micro tears that make intimacy uncomfortable. Medical imaging studies from the North American Menopause Society show that local estrogen depletion can reduce vaginal blood perfusion by up to 60% within 5 years of menopause. This is why even gentle touch can feel foreign. The sensory network has simply gone dormant, waiting for renewed stimulation. Progesterone also plays a quieter role. It supports nerve repair and stabilizes mood by modulating the brain's GABA receptors. When levels fluctuate, women may feel anxious, less receptive, or emotionally detached. The hormonal system and nervous system are not separate. They converse constantly. A decrease in one hormone can ripple through the body, altering how touch, pleasure, and emotional safety are processed. Yet biology also provides a way back. With consistent stimulation through gentle intimacy, physical therapy, or improved circulation, the microvessels in the pelvic region can reopen, allowing tissues to regain hydration and sensation. Clinical trials from the Mayo Clinic, 2022, confirm that increased pelvic blood flow triggers nerve regeneration and boosts the natural release of nitric oxide, a compound that relaxes smooth muscles and restores natural lubrication. These changes are measurable, not metaphorical. Psychologically, this improvement influences confidence as much as comfort. When a woman feels physical ease, her brain releases more oxytocin, reinforcing the sense of safety that allows desire to return. It becomes a cycle of restoration hormones, circulation, and self-perception working in unison. So rather than viewing postmenopausal intimacy as a fading chapter, science invites us to see it as recalibration. The body isn't closing down, it's reorganizing. And with the right care, its capacity for pleasure and connection can be renewed, not imagined, but medically proven. 3. Blood flow and neural activation, the medical mechanism of intimate touch. If hormones are the body's chemical language, then circulation is the messenger that carries every signal. Without healthy blood flow, even the most balanced hormone levels cannot reach the tissues that depend on them. After menopause, as estrogen declines, microvessels within the pelvic region narrow and the capillary walls lose flexibility. These changes reduce oxygen supply to the nerves responsible for sensation. The outcome is not loss of femininity. It is a physiological slowdown that medicine can now measure and, more importantly, improve. Modern imaging technologies such as Doppler ultrasound have shown that gentle physical stimulation, whether through touch, warmth, or even specific breathing exercises, can increase genital blood flow by up to 20% within minutes. This surge delivers oxygen, nutrients, and nitric oxide to the surrounding tissue, enhancing natural lubrication and sensitivity. Nitric oxide, a molecule produced by endothelial cells, acts as the body's intrinsic vasodilator. It relaxes smooth muscles, allowing blood to circulate freely, and it has a secondary benefit. It supports tissue healing and reduces inflammation over time. What's remarkable is how quickly the nervous system responds. When blood flow increases, dormant sensory nerves begin to reawaken, sending electrical signals that the brain interprets as renewed sensation. This isn't fantasy, it's physiology. A 2021 study published in the International Journal of Sexual Health documented that consistent pelvic stimulation improved sensory response in postmenopausal women by nearly 30%. These findings demonstrate that the female body remains responsive and adaptable well into later life. There's also a neurological component as circulation improves the brain's limbic system, responsible for emotion and pleasure, receives stronger feedback from the body. The result is not only heightened physical response, but also a greater sense of calm belonging and vitality. This is why the science of blood flow cannot be separated from emotional wellness. The two systems operate in parallel, speaking a common biological language. If this kind of scientific understanding feels empowering, I'd love to hear your perspective. Type yes in the comments if you believe more women should learn how circulation influences intimacy, or share your thoughts if you'd like future videos to explore this deeper connection between the brain and body. Your interaction helps me know that these discussions truly matter, and it encourages me to keep creating honest, evidence-based content for women over 50. 4. The psychological need to connect and please. While biology explains the mechanics of intimacy, psychology reveals its motivation. Behind every physical act lies a deeper emotional framework, an unspoken need to feel valued, capable, and trusted. For many men, particularly in midlife and beyond, this framework becomes the foundation of how they express affection. Their sense of connection no longer centers on pursuit or novelty. It evolves into the satisfaction of being able to comfort and please the person they love. Research from Stanford University in 2020 found that men experience elevated dopamine and serotonin levels not merely from physical release, but from witnessing their partner's satisfaction. This neurological feedback creates a sense of achievement, similar to what psychologists call competence reinforcement. It reassures them that their efforts hold meaning, that they still contribute to their partner's happiness. This mechanism is not ego-driven. It is an emotional anchor that sustains long-term attachment. With age, many men also undergo subtle psychological shifts. Declining testosterone and rising sensitivity to oxytocin can heighten emotional awareness and empathy. As a result, they become more attuned to their partner's reactions, more responsive to subtle cues of approval or rejection. What might appear as persistence in physical affection often reflects an instinctive need for reassurance, the wish to be accepted, appreciated, and emotionally relevant. Behavioral psychology describes this as the mutual regulation cycle. When one partner shows pleasure or gratitude, the other feels validated, reinforcing the desire to repeat caring behavior. In this way, intimacy transforms into a form of nonverbal communication, an ongoing exchange of emotional confirmation. It explains why many long-term couples find their closeness deepening even when physical frequency decreases. They learn to equate tenderness with trust rather than performance. For women, understanding this dynamic can be liberating. It reframes intimacy not as an obligation, but as participation in a shared emotional language. Recognizing that a man's impulse to please is biologically and psychologically intertwined allows women to receive affection without guilt or hesitation. It also helps bridge the silent gap that often widens with time, where physical distance masks unspoken emotional longing. When both partners understand that pleasure is not one-sided, but mutual reinforcement, connection ceases to be effortful. It becomes what it was always meant to be, the most natural form of emotional dialogue two people can share, regardless of age. 5. Emotional and cognitive barriers in women over 50. Even when the body remains capable of pleasure, the mind often becomes the quiet barrier. For many women, intimacy after menopause is less restricted by hormones than by perception, how they view their own worth, attractiveness, and emotional safety. Years of caregiving stress and changing body image can gradually rewrite self-perception, leading to avoidance, not because of disinterest, but because of fear of judgment or discomfort. Surveys conducted by the North American Menopause Society in 2023 revealed that nearly half of women aged 50 to 65 report diminished confidence during intimacy, citing dryness, weight gain, or self-consciousness about appearance. Yet neuropsychology demonstrates that shame and anxiety directly interfere with the brain's arousal circuits. The limbic system, the region governing emotion and desire, cannot activate fully when the prefrontal cortex is overwhelmed by self-critical thoughts. In simple terms, self-judgment suppresses the very signals that create desire. This pattern, known in behavioral medicine as self-objectification, causes women to mentally step outside themselves during intimacy, observing rather than experiencing. Instead of feeling touch, they assess it. Instead of responding, they anticipate how they might appear. Over time, this cognitive detachment reduces the release of dopamine and oxytocin, creating a feedback loop of disconnection. The more self-conscious the mind becomes, the quieter the body responds. Therapists trained in cognitive behavioral sex therapy often emphasize sensate focus, a method that teaches patients to redirect attention from performance or appearance to pure sensation. Studies from the Journal of Sexual Medicine show that this practice can restore arousal pathways by retraining the brain to associate touch with curiosity instead of critique. It is a psychological intervention with measurable neurochemical outcomes, proof that the mind and body recover best when treated together. There is also an emotional dimension. Many women equate sexual identity with youth, believing that aging automatically diminishes desirability. This cultural conditioning fosters internalized shame that is both unnecessary and physiologically harmful. When a woman feels unattractive, her brain produces higher levels of cortisol, a stress hormone that constricts blood vessels and blunts sensory response. Simply feeling unworthy, therefore, can restrict pleasure at the biological level. Recognizing these barriers is not a confession of weakness, it is a medical acknowledgement. The solution begins not with hormone replacement or therapy alone, but with reclaiming the right to feel alive again. Because intimacy is not defined by age, it is defined by the freedom to experience one's body without fear, comparison, or apology. 6. Therapeutic approach: how to rebuild intimacy safely. Once a woman understands the science behind her body and emotions, healing intimacy becomes less about trying harder and more about retraining the nervous system to feel safe again. Recovery in this context means reestablishing blood flow, hormonal balance, and emotional presence through deliberate and gentle methods that engage both biology and psychology. The first step is restoring physiological readiness. Regular pelvic floor exercises, deep diaphragmatic breathing, and gentle stretching of the lower abdomen improve circulation to the pelvic region. These activities increase oxygen supply, reduce muscular tension, and stimulate the parasympathetic nervous system, the network responsible for relaxation and receptivity. Clinical data from the Mayo Clinic in 2022 confirm that women who practice pelvic mobility routines experience measurable improvements in vaginal lubrication and sensitivity within 6 weeks. Such changes are not symbolic, they are quantifiable. Secondly, reintroducing intimacy should begin slowly and without performance goals. The focus should shift from outcome to awareness, simply observing warmth, breath, and heartbeat. This approach activates the brain's mindfulness pathways, reducing cortisol and enhancing oxytocin release. Couples who communicate openly about these changes tend to rebuild trust faster because they redefine intimacy as a health partnership rather than an obligation. In psychological terms, this is called collaborative reframing, transforming sexual activity into shared self-care. Emotional therapy also plays a central role. Women who have internalized shame or fear often benefit from cognitive restructuring, a process that replaces self-critical beliefs with factual understanding. When the brain learns that discomfort is temporary and treatable, it stops associating touch with threat. Gradually, the body follows suit. This shift restores natural arousal by aligning mental safety with physical readiness. Medical intervention can complement these steps. Topical estrogen, hyaluronic acid moisturizers, or laser therapies prescribed by a gynecologist can rejuvenate the mucosal tissue and reduce pain during intimacy. What matters most, however, is that these treatments are accompanied by emotional patience and self-compassion. Healing does not occur in isolation. It thrives in environments of empathy, communication, and consistent care. When approached as a multidimensional process, intimacy after 50 becomes not a return to youth, but an evolution into awareness. The body once feared for its changes becomes a partner in recovery, a living system capable of renewal when treated with knowledge, kindness, and respect. Translating science into daily practice is where real change begins. Understanding hormones and circulation is only the foundation. Applying that knowledge consistently allows the body to recover its natural rhythm. These steps are designed to help women after 50 restore confidence, sensitivity, and emotional connection in a way that is both physiologically safe and psychologically empowering. The first principle is gradual reactivation. The pelvic region contains a complex network of capillaries and sensory nerves that respond best to slow and repetitive stimulation. Gentle movement, such as pelvic floor exercises or controlled breathing, enhances oxygenation and prevents tissue atrophy. Performing these routines for 5 to 10 minutes each day improves blood perfusion and trains the brain to interpret these signals as comfort rather than tension. Studies in the Journal of Women's Health demonstrate that this kind of mindful body engagement can increase local circulation by nearly 20% within weeks. The second step involves nutritional and hormonal support. Adequate intake of omega-3 fatty acids, vitamin E, and phytoestrogens from soy or flaxseed helps maintain cellular hydration and elasticity. For women experiencing chronic dryness or discomfort, medical consultation is essential. A gynecologist may recommend topical estrogen therapy, DHEA suppositories, or laser micro-resurfacing to restore mucosal thickness and improve sensation. These treatments, when used under supervision, safely mimic the body's natural estrogenic effect without systemic hormone exposure. Equally important is the emotional environment in which these changes occur. Intimacy should be reframed as an aspect of healthcare rather than an act of performance. Open dialogue with a partner reduces anticipatory anxiety and triggers the release of oxytocin, the hormone responsible for calm and connection. Sharing small experiences, breathing together, exchanging gentle touch, or practicing slow physical closeness without expectation gradually retrains the limbic system to associate intimacy with safety. Women who struggle with fear or disconnection may also benefit from cognitive, behavioral, or somatic therapies. These approaches bridge the gap between body and thought, replacing avoidance with curiosity and self-acceptance. The goal is not to return to the past, but to build a new relationship with one's body, one rooted in awareness and respect. Above all, safety must come before speed. Pain, persistent dryness, or bleeding are signs that medical assessment is required, not that intimacy should end. The body remains adaptable throughout life. It simply needs guidance. With patience, correct technique, and compassion, women can rediscover comfort, desire, and confidence as natural outcomes of science working gently in their favor. True intimacy after 50 is not about returning to who you were, but understanding who you have become. The science is clear. Hormonal shifts, circulation, and neural adaptation are part of natural aging, not evidence of decline. When addressed with knowledge and care, these biological changes can actually create deeper, calmer, and more meaningful forms of connection. The first step is recognizing that your body is still responsive. Estrogen may decrease, but your capacity for blood flow, nerve activation, and pleasure remains intact. The nervous system can relearn safety, the pelvic tissue can regain elasticity, and the brain can reestablish its reward patterns through consistent mindful engagement. Every small effort, exercise, open dialogue, relaxation, or therapy supports this renewal at a physiological level. Psychologically, the healing process begins when shame is replaced with curiosity. Self-criticism silences arousal, while compassion restores it. Treating intimacy as part of self-care rather than an obligation invites the body to participate instead of resist. When a woman feels safe, her body responds naturally, reminding her that desire is not lost, it is simply evolved. My message to every woman listening is this: you are not broken. You are biologically adaptable, emotionally resilient, and still entirely capable of pleasure, trust, and closeness. Rebuilding intimacy is not about youth. It's about awareness, patience, and the courage to begin again. Thank you for spending this time with me and for being part of this growing community of women who value science, honesty, and self-understanding. If you found this helpful, please subscribe and share this video to help more women discover that health and confidence do not have an expiration date. Your support brings me closer to our goal of 10,000 subscribers and gives me the motivation to keep creating evidence-based guidance for you every week.